Now, for the health segment today, we'll be looking at the similarities between COVID-19 and symptoms like or diseases like malaria and cold. So if you have any questions for Dr. Kelvin as we're talking to him, let us know with the hashtag Breakfast Daily and the WhatsApp line 0550-585-832. If you're outside Ghana, the country code is +233. We'll be getting Dr. Kelvin shortly, but a lot of you have already sent in your messages. And remember, the best way to beat coronavirus is to ensure that our immune system is strong. So as you're waking up this morning, I hope that you're going to eat more fruits, more vegetables. You try and walk around your area or your apartment to keep your body healthy. And of course, you have to wash your hands with running water and soap. Maintain social distance with every single person, not just anyone who might show signs and symptoms of COVID-19. And it's important to put on a face mask when you're stepping out of your house. The two reasons why: it's one, you may be asymptomatic and you don't know that you are carrying the virus. The last thing you want is to pass it on to your friends who you love so much, because some of them might have weak immune systems and they may not be able to fight the virus. And the second reason is because one of your friends may be positive and they don't know their status. So if you're hanging out with them and they sneeze or something, chances of you catching it may be high. So it's important for every single one of us to keep in mind that we are in control of this. We have to be safe and pay attention. If you wake up and you have a little bit of a cough, it could just be a cough. It's not coronavirus. So Dr. Kelvin Owusu will help us appreciate all of that. And again, if you have any specific questions for him relating to coronavirus, malaria, cold, or anything at all that has to do with your health, we want to give him those questions. So let us know with the hashtag Breakfast Daily and the WhatsApp line 0550-585-832. We are live on Facebook, YouTube, and all other social media platforms, so you can comment below in addition to sending that hashtag. Of course, Dr. Kelvin is the Medical Director of Asymptomatic Diagnostics, and it's always a pleasure to have him here every Tuesday. Good morning, Dr. Kelvin.
Good morning, Dziffa. How are you doing?
I'm good. How are you?
I'm very well.
Belated happy birthday. I heard that you're celebrating your birthday last week. How was it?
Oh, well, it was a lockdown birthday, so not much celebration. We have postponed the celebration till after the corona.
Aww. Now, similarities between COVID-19 and malaria. What should we be looking at? Because a lot of people are paranoid right now. They wake up with a little bit of mucus and they are thinking, oh my God, I think it's corona. So what are some of the similarities?
Well, they are right. They are right in being worried, because the big challenge, especially with this corona, is that the symptoms are very, very non-specific. I mean, there's no one thing that you attribute to only coronavirus, or you say that it's only due to coronavirus. It's not like none of the symptoms of coronavirus are peculiar to coronavirus alone. And so that has been one of the challenges for the health sector, because if a patient walks in and thinks he or she has malaria, and you as the health worker, you don't take the necessary precautions of wearing the PPE or whatever, it could turn out that person actually has coronavirus, and then you assume it was malaria or something else. And so it's a challenge for both the health worker and the patient in this particular case.
Okay, so Dr. Kelvin, what are some specific symptoms that we should be paying attention to?
So we already know the symptoms of coronavirus. There's headache, there's fever, there's cough. Some people may have a sore throat. There's general body weakness, and so on and so forth. All these things are similar to other disease conditions. So let's take something like malaria. If you had malaria in the early stages, you could have fever, you would have your headache, and you would have your general body weakness and all that. These are also symptoms of the coronavirus. And so there is some similarity in the symptoms when it comes to malaria and coronavirus. When you look at common cold, if you had a common cold, you would probably have a runny nose, you still have the headache, you'd have the general body weakness or general body pain, and you could have a fever as well. Again, all these things are similar to what you could have, or the symptoms you could have when you have coronavirus. And so, as I said in the beginning, the coronavirus symptoms are highly non-specific, and that presents a challenge when it comes to dealing with this particular issue, as we discussed earlier.
Okay, Doc, so we have some questions here for you. Let me see. I'll go through them one by one. So Anthony says, hi, Doc. I've been experiencing some light headache, chest pain, and sometimes the pains travel from the chest to my ribs, the left side, up to my waist. All these are light pains. Please, what could that be? So this isn't necessarily coronavirus, but he wants to know what's going on.
Well, so I pain that is traveling is not likely to be coronavirus. It could be something else, and chest pain that travels around the body. The chest has there are lots of organs in the chest. We have the lungs, we have some blood vessels, among other things. All these things, when they are affected or when there's something wrong with them, they present as pain. Now, depending on, it will give you an idea of what's going on. But essentially, this person, and this is a caution I give all the time. If the symptoms are not too severe and he can wait it out, he can wait until this coronavirus comes down a bit, then I recommend that he waits until the coronavirus comes down, then he can report us for the appropriate testing done. However, if the symptoms are severe and unbearable, then we are going to go to hospital, but then do the appropriate test, an ECG and other related tests to find out exactly what is going on.
Okay, so there's another question here. Let me get that for you. I hear that when the virus enters your immune system, the symptoms associated with it is what the doctors treat and not the virus itself. After these symptoms are treated and the immune system boosted, then the person now tests negative, is discharged. What is the probability that the virus will not attack the recovered person again? So the Eagle is saying that, well, the name is Favorite Eagle. He's saying that he hears that the virus enters your immune system, and then so what the doctors are treating are the symptoms and not necessarily the immune system. So when you go back home, what's the probability that you won't get attacked by the virus again if you are not killing the virus but just treating your immunity to it or the symptoms? Did you get the question, Dr. Kelvin?
Okay. Yes, I get it. So in the hospital, what the doctors are trying to do is, one, keep the symptoms in control, because if you are coughing so much, if you are vomiting, if your temperature is too high, all those can result in complications. And so we want to control the symptoms as much as possible. In addition to that, we also want to slow down the replication of the virus. And when I say replication, I mean the rate at which the virus is dividing. Because if it's dividing fast, if it is affecting or infecting more cells, that means that it's going to break down your system much faster. So we also try to slow down the replication of the virus. And that is where in the past we had things like chloroquine and other medication being mentioned as being effective in slowing down the replication. Ultimately, to clear the virus, it's your immune system that will do that job. When we slow down the immune system, when we slow down the replication of the virus, it helps your immune system to overcome the few virus elements that are still present in your body. However, after you have been cured or cleared of the virus, and as to whether the virus can reinfect you or not, I must say that the evidence is still not 100%. We are not too clear what the way forward is. For now, generally, most people who have recovered the virus have not been reinfected. A few people have been reinfected, but we cannot conclusively say that the virus can reinfect the person. We don't have the full information to draw that conclusion at this point. The hope is that this virus will behave like chickenpox. That chickenpox will usually attack you once in your lifetime, and then you build immunity against it, so that subsequently you cannot get infected by chickenpox. That is the hope. But it's also possible that because it's a cold virus, a coronavirus, they might also have behave like the common cold virus, which can keep reinfecting you so long as you expose yourself. either way, what we can do is that we can prevent infection by making hand washing a part of our daily activity, a part of our life, social distancing a part of our culture, and then of reporting also early so that we are isolated should there be an infection. These things should stay with us. They shouldn't go when coronavirus goes. It's very, very important.
Okay, so speaking of the hand washing, there's a question here about how exactly does, if you wash your hands, how is that killing the virus if we say that there's no cure for the virus? So if someone has coronavirus, they wash their hands, they come to touch you, do you now not get the virus because they wash their hands?
So the virus attached. So let's say somebody coughs or you cough into your hand. The virus is inside the droplets. The droplets have fallen on your hand. The virus is going to attach to the skin of your hand. Now, when you wash your hand with soap, there are chemicals in the soap that break the bond between the virus and your skin. So that then the water then simply washes off the virus from your hand. I don't know if that makes sense.
Yeah.
And so then the virus then sort of falls down and is washed away. So the soap, not all soap. Some soaps may not necessarily kill the virus, but it removes the virus from your hand. And this is one of the reasons why they say that the water you use should be running water. It shouldn't be water in a bowl. Because if you wash your hand in a bowl, the virus is sitting in the bowl waiting for the next person to come and also wash their hand and carry the virus away. And so most soap and the basic of soap have chemicals in there that will lyse the bond between the virus and your skin. So that when you have rinsed your hand with the water, it washes away the virus off your hand. So now your hand is virus free. So that when you now eat with your hand or you rub your eye with your hand, you are not likely to get infected because your hands are considered clean, or your hands are actually clean in the sense of the word.
Okay, there's a question here from Bossman. He says, I'm asthmatic. What are my chances of surviving coronavirus?
Your chances are quite high, especially if your asthma is well controlled. Asthma is a problem, or it's an issue with the respiratory system. Your respiratory system, your what's it called? Your airways tend to be hyper responsive, so hyperreactive, and then they over secrete. Should I say secretions? There are a lot of secretions, and so when there's a trigger, and some of the triggers include pollen, and could be some people are triggered by rice and other food items, and so you need to know your trigger. Now, if your asthma is well controlled, if you are compliant on your medication, you are using your inhaler regularly. I mean, there are two kinds of inhalers. There are preventers and relievers. The preventers are taken every single day, depending on how severe your asthma is. So if you are compliant on your preventers and you have access to your relievers, you are pretty much safe. The whole idea of managing asthma is to bring you to as much normalcy as possible. So if you are compliant to your medication, then you and coronavirus may not necessarily have a terrible outcome. However, because you're asthmatic, when you do have symptoms or you do feel like you are coming down with something, you should not ignore it. You need to respond as quickly as possible by calling the Corona helpline or getting in touch with your regular doctor, letting him or her know that this is what I'm experiencing. With my history of asthma, I feel something should be done about it. You need to be more proactive than the normal or than the ordinary person on the streets of Accra will be, so that you can prevent a worse outcome. The challenge with asthma is that people tend to report hospital late. And because they are reporting hospital late, the complications have already set in. And so once the complications set in, of course, the outcome tends to be a negative outcome. So let's make sure that we are compliant with our medication, avoid the triggers, and then should we experience anything, let's report to the appropriate authority early enough.
Okay, thanks, Dr. Kelvin. And again, if you have any questions for him, let us know with the hashtag Breakfast Daily and the WhatsApp line 0550585832. If you're outside Ghana, the country code is +233. We started off discussing similarities between COVID-19 and sicknesses like malaria and cold, and now we're answering some of the questions you have. And they don't necessarily have to be COVID-19 questions. Just send them over, and I'll do well to ask him for you. There's a question here. Says, good morning, please. My throat is dry with no cough nor fever, but I feel mucus congestion within my chest. All this started after I was directed to take Zincovit. What could the cause be? Or what could be the cause?
So, so dry throat and congestion in the chest and all that. I mean, it could be that you are coming down with a common cold. However, we are in the corona season or corona era, and so the question remains: have you had any recent travel history? Have you had any contact with anybody who has had any recent travel history? Have you had any contact with anybody who has been diagnosed of having coronavirus? And so these questions become critical so that you know whether or not you have coronavirus or it's just a common cold. Either way, I'd urge you to keep to call the corona helpline, and then they'll take you through the questionnaire and then take it from there. Most probably they'll ask that you do the coronavirus test so you can get it out of the way, and then you can then get access to the necessary treatment. That's if you actually do need treatment for that matter.
Okay, so another question here. Dziffa, please ask Dr. Kelvin that if I use a hand sanitizer, how long will it take before I'm exposed to the virus again?
So the thing about it does not replace hand washing. Now, this is very, very important. The hand sanitizer does not replace hand washing. Hand washing is number one. Hand washing is superior to sanitizer.
Mm-hmm.
However, in the event that you can't have access to flowing water and soap, you can use a sanitizer. Ideally, after every 2 or 3 uses of sanitizer, you should actually wash your hands. Because the thing is, just like hand washing, when you use the sanitizer, it is effective at that point that you have used the sanitizer. Anything that has accumulated on your hand, so the point when you use the sanitizer will wash it off or will deal with it. But understand that the sanitizer dries off within a few seconds that you have used it. Same way when you wash your hands, you dry your hands. Your hands can become dirty if you touch or interact with any other surfaces around you. And so in terms of duration of effectiveness, it depends. If I wash my hand right now and immediately I finish washing my hand, I go and touch a table, I've contaminated my hands again. And so I have to wash my hand again before I go and eat. But if I wash my hand and I immediately go and eat my food, I am covered because I didn't touch any surface at all. So same precautions apply. Don't sanitize your hands, go and touch surfaces and then go and eat, assuming that the hand sanitizer is still effective. No, it doesn't work like that.
Okay, so what you're saying is when we wash our hands, we're actually washing the virus off. It's not that we are washing our hands to prepare to fight the other viruses that we may touch, right?
Exactly.
Okay, so
exactly
if you go touch something, you should go wash it again. Or use the hand sanitizer again.
Let me just check this thing.
Okay.
Now says everybody needs to wear a face mask, which is good advice. But then the thing is, before you wear the face mask, you need to wash your hand before you put it on. And every time you touch the face mask, you have to wash your hands or you have to use the sanitizer. So don't touch the face mask and then continue with whatever you are doing, forgetting that you have to wash your hand. Because when you now try to take out the face mask or put another one on, they are going to interact with your face, and that could then expose you to the virus again.
Okay, so there's a question here, please. Is it possible for a COVID-19 positive patient to remain asymptomatic until he or she becomes negative? Secondly, does one's blood group have a link to one's resistance to the virus?
So, yes, a person who is COVID positive can remain asymptomatic until he or she becomes negative. It's very, very possible. Highly, highly possible. In fact, that is the more reason why, I should say, that's the more reason why, it's because of the asymptomatic people that there was a need to lock down. The idea is that if somebody were sick with corona and was coughing, there would not be any need to lock down because you can tell that this person is sick and avoid that person. But in fact, it looks like majority of people who actually are exposed to the virus are not going to show any symptoms. So they're going to be going around their normal activity. Unfortunately, it is also these very asymptomatic people who are most likely to spread the infection to everybody else. And that's why we keep saying that stay home, because if you happen to be carrying the symptoms, but then you take that infection to visit the mother. The mother is an elderly person or somebody who has diabetes or kidney problem. you take the infection to that woman, she gets that infection from you. Even though you didn't show any symptoms, she could end up dying because of the infection that you have given her. And so that's what it applies to. It applies to all of us, because you cannot tell who has the infection, because a lot of people will be from the president's address. He mentioned that if I remember correctly, as much as 90% or so of the people tested were actually asymptomatic. So that makes it clear that the majority of people who are infected will be asymptomatic. So it's a very, very, very big deal indeed.
Okay. Another question here, please. Is the fabric face mask effective? I've seen a communication going around that it is not effective.
So this is a difficult question to answer. See, the challenge is that the fabric face mask, it depends on, first of all, it depends on what kind of fabric they are using. It depends on
the African print fabric face mask, for instance.
Yeah, I know. I'm saying that if in the African print, there are different qualities of African print. So it depends on the quality of the fabric they are using. It depends on how many layers of fabric that have been put together. And it depends on whether they put some material in between the layers of fabric to increase the efficacy or the quality. You see, because everybody is now coming up with fabric face masks. We don't know who is doing it right and who is not doing it right. So, I think at this point, maybe the standards authority may have to come in and give us a standard, or, certify some manufacturers so we know that what they are producing is actually good enough. Because if you just take anything and put on your face, they might not them are 0% effective. Some of them don't do anything at all. Yesterday I was driving around, and I looked on the street, and somebody had a hair net. You know what I mean? A hair net covering her face.
Maybe it's a mental thing.
So we really have to be careful what we are using to cover our face, because yes, in as much as everything is better than nothing, sometimes nothing is even better than something. So we have to make sure that we are using the right face mask. If we can't get access to the surgical or the hospital face mask, the cloth face mask is effective provided it's done well. WHO recommends a 3-ply. When I say 3-ply, what I mean is if you look at toilet roll gives me the best analysis. The sheets sometimes come as 2, sometimes come as 3. The 3 is a 3-ply. So WHO is recommending a 3-ply and fabric face mask. So if your fabric face mask is not 3-ply, then it's not as effective as it's supposed to be.
Thank you.
Some people also have a 2-ply where they put stiff material. The material is to slow collars and all.
Thank you very much, Dr. Kelvin Owusu. We have a lot more questions for you, but unfortunately we've run out of time. But on behalf of the entire Breakfast Daily team and the Citi TV crew, we want to wish you a belated happy birthday. Nase Puku. We are so grateful and thankful for everything that you do for us.
Don't
go anywhere, guys. We'll be right back.